Hey ladies and gentlemen, this is Ekayani Chamberlin, your health and lifestyle coach out of Greenpoint, Brooklyn. And as promised, this is the second in a series on vitamin D and its importance. I wanted to start off by saying that my grandfather, Bernardo Lapallo, he makes it a point to get at least a half an hour to 40 minutes of direct sunshine a day, and he's been doing that for quite a long time. And at the age of 112, he's still healthy. He doesn't have cardiovascular disease, he doesn't have cancer, he doesn't have diabetes. So I wanted to take this a little bit out of the realm of the anecdotal and provide some hard scientific information in the form of this article on this clinical trial and study, and let you know that this information comes to me courtesy of USANA Health Sciences. So the name of this article is called Treating Vitamin D Deficiency in a High-Risk Population Living in Northern Climates. Specifically, it's talking about African Americans, people of color, people with darker skin that are living in the north that definitely has a much lower concentration of sunshine that you would find closer to the equator in Latin America, the African continent, etc. That's why darker skins are darker, because it protects, but when you're living farther north, obviously it's going to take more sunshine and more vitamin D to stay healthy. So that's what this is addressing, which I mentioned in my previous video about how little time we spend outside and how much time we spend inside. So let's get down to it. A new study shows that high doses of vitamin D supplementation in African American adults may be needed to meet even minimal recommended blood levels. The African American population is known to have higher rates of cardiovascular disease and cancer than any other American adults. It has been proposed that this may be due, in part, to lower circulating vitamin D levels in this population. In a recent study published in the American Journal of Clinical Nutrition, researchers sought to determine the dose-response relation between vitamin D supplementation and subsequent blood levels of vitamin D. The study was conducted in Boston, Massachusetts, and included 328 African American adults who were enrolled over 3 winters from 2007 to 2010. Participants were randomly assigned to one of 4 supplement groups, taking either a placebo or 1,000 IUs, 2,000 IUs, or 4,000 international units of vitamin D daily. Diet history and socioeconomic information was collected from all subjects, and blood samples were collected at the beginning, again at 3 and 6 months. At the beginning of the study, the average vitamin D level for each group was below the levels recommended by the Institute of Medicine, which is 20 nanograms per milliliter. So this is a measurement, of blood serum levels, within the bloodstream. After 3 months of supplementation, the vitamin D level in the placebo group fell from 15.1 nanograms per milliliter to 13.7 nanograms per milliliter, while the group supplemented with 1,000 IUs, 2,000 IUs, and 4,000 IUs rose to 29.7 nanograms per milliliter, 34.6 nanograms per milliliter, and 45.9 nanograms per milliliter, respectively. The dose required to increase blood vitamin D levels to 20 nanograms per milliliter in more than 97.5% of the subjects was estimated to be 1,610 IUs. Supplementation with 4,000 IUs was needed to reach vitamin D levels of at least 33 nanograms per milliliter in more than 80% of the subjects. In the study of African American adults, supplementation with 4,000 IUs per day was needed to achieve vitamin D concentration shown in observational studies to reduce the risk of cancer and cardiovascular disease. High-risk populations living in northern climates should be encouraged to discuss vitamin D supplementation with their health care professional. And I want to give credit to Kimi NG et al. For dose response to vitamin D supplementation in African Americans and results of a 4-arm randomized placebo-controlled trial that was published in the American Journal of Clinical Nutrition of March of 2014. That's March of 2014 of this year, volume 99. So you probably know someone who's battling cancer. You may know someone who's had it repeatedly. You may sadly know someone who's lost that battle. Cardiovascular disease, of course, is an epidemic proportion in the African American community, concomitant with, obesity, diabetes. So all these things, as the body is working in synergy, are related. So if you're feeling like perhaps you need more vitamin D supplementation, or you know someone who needs that, encourage them to get a blood test from the doctor to check their vitamin D serum levels. Also, I want to encourage you that if you like this information, I have lots of more good information like this to share through my blog, which is thelivingconnection.blogspot.com. You can also go to my Facebook page. That's The Living Connection with Ekayani Chamberlin. That's me, yours truly. And also, I would direct you to my website where you can take a free True Health assessment to get a bead on what your supplementation needs may be. So that is simply my name, ekayani.usana.com. It takes about 15 minutes to fill out. You go to the tab that says True Health Assessment. It's free, and it'll give you a picture of where you want to go. So take care, be well, enjoy the sunshine. That is it's the second in a series on vitamin D. And until the next time, enjoy the sun.